Abubakar Abdullahi, thank you for making time for us. This is TV47 Spotlight. Remember, you can be part of this discussion. Tweet us at TV47 Spotlight. Text us on the number 22047. And of course, you can call in on the number on your screen and be part of this discussion. My guests tonight, Dr. Peterson Wachira, the National Chairman of the Kenya Union of Clinical Officers, and Cyrus, Oguna, the government spokesman. Thank you, gentlemen, for making time for us this evening here on TV47.
Thank you very much.
Let me start with you, Cyrus. Understanding that President Uhuru Kenyatta publicly apologized for the excessive use of police force today, surely one will argue that the family of perhaps Yasin Hussein Moyo, a 13-year-old kid who was brutally murdered, will need more than an apology, isn't it? They will need justice.
Indeed, that was an unfortunate incident that did happen on that day. And the president stepping forward and apologizing is a very, very big statement. And the issue is being investigated, and as soon as the investigations are completed, we'll be able to know which action the government will take moving forward. And
in a country that we have seen investigations take time, delay, with often no results, is there confidence that this will be brought to justice?
I think what we need to do is just wait and see how the investigations will progress, but we want to assure the public that once the investigations are done, the report will be made public.
Fair enough. And still on the curfew and what we saw, the Human Rights Watch website has an article that I was reading earlier on, says Kenya police abuse could undermine coronavirus case. The curfew, the article reads, started off on a wrong foot with the police across Kenya reportedly using excessive force, beating and tear gas. What the government may have seen as a step in stopping the virus is blamed here as though it is a step in increasing the numbers. Your reaction to that as the government spokesperson?
No, really. We must also understand that the police work under very, very difficult circumstances. It is very easy to point a blaming, a finger of blame at the police force without necessarily, taking time to appreciate under what circumstances that they operate. But we must also say that whatever did happen on that day one of the curfew is something that, as a government, we did regret. And the head of state himself, pronouncing himself to it, like we did say at the beginning, is a fairly good statement, coming from the head of state. However, we must also understand that when laws and rules and regulations are put forward, we don't require the police to, to come for us to be able to obey them. These laws and rules are supposed to be self-enforcement or enforcing. So, whatever is there, that was been put there by by the state in terms of directives are actually intended to protect our lives, to protect our health as a people.
But it seems as though it is doing quite contrary to that, isn't it?
It's not.
And I'm more than confident as the government spokesperson, you must have heard of the cliche around that COVID has claimed the life of one Kenyan.
Not necessarily.
The police have 3 so far.
Not necessarily. That it's a regrettable incident, and we say that investigations will be carried out and the outcome of the investigation will be made public. But I must also say this, that when an incident happens in one region or one locale, it is not enough to assume that the entire country, the same things did happen. There are many, many areas in this country where the police behaved so humanely, behaved so with a lot of decorum. They assisted. Sometimes it makes one to want to ask the questions, when will we also see our police force or men and women in uniform as heroes? There are many, many heroes out there. And therefore, when an incident like that happens, of course we regret it. But it does not undermine the fact that there are many, many other situations where the police have done extremely, and they continue to do extremely well. And they should also be celebrated.
But isn't it not the case that when you have death cases as such, that often gets to the highlights?
I think we should also be a society that celebrates its heroes. We have spent, many, many hours talking about, negative issues, and by doing so, we lose sight of very, very good positive things that happen in this country. I think we need to step back and look at what in this country is it that we do as a country that is positive, that we must also be able to highlight with the rest of the world, as opposed to, quite often just focusing on negativity. Of course, it shouldn't be happening, but it does. It did happen, and like we're saying, that we should not focus so much on it because it is already being investigated. The head of state had pronounced himself to it, and he apologized to the country.
through teleconferencing earlier on today.
Very big statement that was made by the head of state. And it's something that we should actually be able, as a country, to look back and say, yes, the head of state apologized to it. The police also did apologize to it. And those two are very, very big, pointers to the fact that this is a country that's, governed by the rule of law. And the rule of law must at all times be at, the forefront of every action that we take as, government and even as security forces.
I really
when one person does make a mistake or two person do make mistakes, it does not mean that the entire action by the police is actually, is reflected on, in light of the two, incidences that may not have met, the requirement of the rule of law.
It's something noble. I really want Dr. Peterson to bring Dr. Peterson to the discussion. But as we finish on the curfew and what we have seen of late, it's one thing to apologize. It's another thing for families to lose life, isn't it? Why apologize if it was avoidable in the first place? Now, spokesperson, I think that...
It's me?
Yes.
Yeah, okay, fine. Mistakes do happen, and I am not the investigator right now, but I trust that whoever did that action, wherever he is also regretting that did happen, I trust that he did not do it on purpose, right? But sometimes even apology sometimes carries much more weight than compensation, and I don't know what investigation will reveal out. All right. So my request as of now is that why don't we allow investigation to be carried out, and then it will make several recommendations, and based on what it will recommend, then action shall be taken on the basis of the weight of the recommendations.
Fair enough, Dr. Peterson. Let me bring you to the discussion. There are quite terminologies that I love you to probably explain to us: community immunity and herd immunity. What often are those words in regards to the individual's immunity?
Yeah, thank you, Ali. And maybe before I even answer your question, I would wish to stand together with the health workers in this country. And I would like to stand together with a pledge that we are sharing as a way of showing commitment to the country and standing together and surely giving strength to each other during this time. And I will say that I, Peterson Wachira, being a clinic officer in this country, I dedicate myself to be a frontline health worker in this COVID-19 pandemic, and that I will do all I can to take care of Kenyans, and as I will be empowered by God.
Apocalyptic of life on air, isn't it? Go ahead.
Yes. So that's a pledge we are sharing as medics, because you understand that it's also not easy for us. And before maybe I answer your question, allow me to also comment on maybe the question that you asked there before. Because as health workers, I think our work is protecting life, and protecting life even sometimes at the expense of sacrificing your own, like we do most of the times. And I must say that as also Kenyans, we must also be able to look at the excesses that we are having of the police, because we said we are turning from a police force to a police service. And surely we have seen excesses. We have seen these excesses before when the police have been trying to enforce some laws. And I think it's time we call it out and look for solutions as to how we can be able to do that. So when we come to the community immunity and the herd immunity,
yes,
I think we are talking almost the same thing. Because by herd immunity we mean when in a community about 80% will have some immunity to a condition, like it happens with our vaccination. The reason as to why we give vaccination, sometimes it's very hard for you to achieve 100% coverage. But once you reach 80% and above, then you have herd immunity that protects that community, because a majority of the people have already have immunity to that condition, and therefore you do not have that kind of condition or disease in that society.
And can one with that herd immunity be affected by such a disease, irrespective of what the disease is?
The herd immunity will be to a specific disease. Like if we are talking about measles, the herd immunity that you get after being vaccinated, majority of us, will be for that specific condition, but it will not be for another condition. But for the individual who maybe had not been vaccinated against that, if you will be in a place where you are having people who are having the same disease or condition, then of course you are going to get it. But within the population where majority have been vaccinated, it means you will not have that disease, and of course therefore you are not going to get that disease.
Dr. is still on this issue, looking at the statistics more so on gender. In Italy, 71% of the people who died of coronavirus were men, 29% women. In China, 64% men, 37% women. Spain, 65% men, 35% women. Is there scientific evidence of the reason as to why one gender has more mortality rate when it comes to COVID-19?
As for now, you know, there is a new disease, and it's something that is under research. And I know there may be research that is ongoing, but as for now, I cannot tell you with confidence that this is the reason as to why we are having many men than the females. But yes, we have seen that for some reason, it's affecting more of the males than the females.
Good. Can I also, well, I'm not a doctor. I'm just thinking, if we look by, social interactions and the fact that this disease is passed largely between, from contacts or being close to somebody who is infected, I would imagine that, men have got more interactions, more contact, and that may perhaps predispose them to being very easily, not easily, but perhaps, makes them to have a larger environment, large more conducive environment to be infected. So we may probably find a lot more men are infected because of having a lot more contact and meeting different kinds of people, unlike, well, I'm just thinking, I'm not saying this is scientific, but just thinking that from a layman's point of view.
Yeah, actually it's true. It's, we can say it's, yes, it's not scientific, but it's true that it's because of the nature of men that we interact a lot, and of course we travel a lot and we meet many people, and therefore when it comes to a condition or a disease that you are going to transmit in the same way that you are transmitting this corona, of course more men will be than females, but maybe for the scientific reasons we may come to maybe to find the reason later.
Good. Colonel, let me ask you this question. Earlier on, while addressing the media, the Health Cabinet Secretary, Mutahi Kagwe, told, and I quote, Kenyans to brace themselves for stiffer measures. In your own observation as a spokesperson, this is, of course, his thoughts, but what will include these stiffer measures?
Well, I think what is important really to realize and ask yourself, why would we want to get to a situation whereby government institutes other stiffer measures? We don't want to get there, and we will not get there if we obey the measures and regulation the government has put in place. And the measures and regulations are very simple. Stay home. Basically, stay home and wash your hands. For 20 seconds using soap and water and minimize contact. It's as simple as that. But if we do not do that, we do not obey that, then, looking at, the fact that this disease is already within our communities, within our society at large, then it is likely that infections will rise, and the only other way, therefore, that would be left to try and stop infections is to institute other stiffer measures. Yes.
And I'm asking what is inclusive of that stiffer measures?
This is a multi-agency kind of campaign that there are many agencies that are looking at it. And I cannot be able right now to say what are these stiffer measures, but certainly, they are reviewing development, day by day, and they'll be able to advise what other measures need to be, instituted. Well,
speaking to a competitor, another media, for the lack of a better word, on the 23rd of March, you said, and I quote you, Cyrus, a lockdown is something on the table, but we do not want to get there, and we will not get there if our people are able to obey the advisory and measures put in place. In your own observation, do you think people are obeying these measures as of now?
Well, we must say that largely many people are obeying these measures. But of course, we know there are pockets whereby there are those sometimes who, for one reason or another, are complacent about these measures, are complacent about these regulations, and indeed, if we do not necessarily as a society be able to take these measures seriously, then other measures that are most stiffer would have to be instituted. We don't want to get to that situation, honestly.
Is a lockdown on the table for this matter?
It is a consideration that is being done. I'm not saying that it's being looked into. We are looking at all possible options, as a government. We don't want to be caught on the wrong footing. And therefore, we must weigh situations, we must weigh scenarios and even model those scenarios and then come up with contingencies, to deal with each scenario. So what that means is that, that lockdown is among the various options that the government is looking at.
And what will prompt a lockdown?
We are, every day the events as they unfold are being analyzed, are being assessed by a multi-agency. And that multi-agency, like I did mention, just a short while ago, comprises different entities from government and even from outside government. So they'll be able to advise what are the appropriate measures. So right now I cannot necessarily say that this is what will have to happen in order for a lockdown to be instituted.
Yeah, maybe if I can also contribute to that.
Go ahead.
And, I think we're on record as a Kenya Union of Clinical Officers coming out and asking the government at the earliest possible time to institute a lockdown, and especially on the counties that are considered hotspots. And why are we saying this? Once you start having community transmission of any infectious disease, it becomes very hard for you to get each and everybody who is having this infection. Because when you're talking about contacts, there is always that contact that is never documented anywhere. There is that contact. For example, a case scenario, if I was coming here today, and then let's say I was walking, there is somebody that I may have met outside in the outside parking, and maybe for one reason or the other, maybe they were on a call or something, we happened to be at the same place for a minute, and maybe I was coughing. And the person does not realize that they are my contact, and I also don't realize. And that is what usually happens when you're having an outbreak of an infectious disease. So when
isn't it not the case that if a lockdown is supposed to be in place, it will be more than the medical part of it? It will mean a shutdown of the economy, people not moving out of their houses, while a large population relies on the works of the day?
Yeah, of course there is that part, and that is why the government is there to ensure that for anybody who cannot be able to feed themselves for that time, I'm sure the government will have some contingency measures where they are going to ensure that they provide for them. But what I'm trying to say is, for you to cut this transmission, because it's by contact, then at some point you'll have to ensure that people are not moving, because the virus does not move. We are the people who move it and transmit to each other. And the only way you can bring it to a total halt is through a lockdown. And that is why we are saying we will support the government at the earliest possible time for it to institute a lockdown. And we are saying this because even if we look at economy, if you do a lockdown, a total shutdown at the earliest time when you're having fewer cases, then you'll have this shutdown for a shorter time, and the economy will not be affected as much. If you wait until you have so many cases, that lockdown will have to be countrywide. It will take quite a long time, because you have to ensure that you have halted this spread, and of course there will be, to a greater extent, of course there will be that economic challenge.
Impact, yes.
And so for us, we see an early lockdown as actually a better solution, so that we can be able to get all the cases isolated, and within a very short time, we come out of it, and then we continue with our lives as Kenyans.
Fair enough. It's 20 minutes past the hour. Remember, you can be part of this discussion. Tweet us at Tv47KE. Send us a message on 22047. Call us on the number on your screen. And just a repeat that Kenya's confirmed coronavirus cases have increased by more than a quarter in the last 24 hours to 81 cases, with the Ministry of Health reporting the highest number of positive cases in a single day. 22 cases, among them 18 are Kenyans who are spread across the country, with the counties of Murang'a, Machakos and Kiambu and Nyamira registering their first case. The additional 4 are 2 Pakistanis and 2 Cameroonians. It's time for us to take a short break here on Spotlight. We'll be back with this discussion after this break.
To stop any viruses from spreading is by washing your hands. But did you know by using any soap, you could get rid of all disease-causing germs? The fat layers that attach the virus to the hands get pulled out, and the soap demolishes these viruses. It takes at least 20 seconds for this effect to take place. You do not have to go for soap marketed as antibacterial. In fact, the US FDA recommends you skip it. There is no evidence that it kills germs better than ordinary soaps. This message is brought to you in the public interest by Imperial Leather.
My name is Sujata Kotam Raju. I am the National General Secretary of Hindu Council of Kenya. Namaskar to my dear sisters and brothers. Now this is the time everyone will have to take the responsibility to fight against this virus, not to spread further in this country. If at all, if you want to go out, maintain the social distance. Avoid going to the enclosed areas like supermarket, temples, churches, and any religious functions. Avoid shaking your hands and hugs, any form of physical contact. You can just say Namaste. For more information, dial 719 or *719 hash. Kamesha Corona.
Thank you for choosing to stay with us. Welcome back. You are watching TV47 Spotlight here on the home of untold stories. Kosgei Ryan is asking on Twitter if the Ministry of Health has projected all these numbers, why not advise the government to go on a full lockdown in affected cities in order to break the cycle? This ultimately will happen when it's late and the numbers are beyond control. Cyrus, you want to react to that?
Yes, it's the same thing that you're saying, that there's a multi-agency that is working on looking at how the situation is unfolding, and they are weighing all options, and those options are not just option that looks at the whole country as a one entity, but also looks at various counties, and therefore that a multi-agency will be able to make a decision with regards to what needs to happen. But that it is now, all options are on the table.
Fair enough. Dr. Peterson, let me ask you this question. There are those who say Kenya's cases are so because we invited more or less this COVID-19. What's your view in that as a medic? Inviting in the sense that the movements were allowed?
I think Kenyans maybe can say that, but the truth of the matter is...
No, as a medic, do you think so?
I've also participated in an outbreak of Ebola in West Africa, where I actually led a team from Kenya to Sierra Leone. And one thing I know, you can delay, but you can never close the virus out of your borders. So it was bound to come, and I remember in earlier interviews I said, even here, that the virus must get into Kenya, whatever we do. It's only that we have to prepare and plan ourselves to contain it when it comes in here. But maybe we would have delayed it a bit. But we cannot totally prevent the virus from coming into the country.
And what will delay it a bit would have included?
Of course, what has happened, where you're stopping the foreign travels, where you're stopping planes from coming, of course that works to delay.
Fair enough. Maybe let me ask you the same question. Given that when, and she is not here to respond to this, the Foreign Affairs Cabinet Secretary was asked, she said allowing the passenger flights were quote in the best of the interest of the country. Surely looking back 2 months later, it doesn't seem as though they were in the best interest of the country.
Your question is based on one flight that everybody seems to be referring to. And I must say here that all the tests that have been conducted, none of the 239 who came on that flight
were from,
tested positive of corona. And therefore, basing all arguments on that one single flight is not necessarily fair. And like Dr. is saying here, at some point, we are going to get this virus here. It is happening globally. We are part of global community of nations. There is no way that you're going to stop it completely from getting here. And if you look at what measures that we have put in place as a government, they are the measures that we would have put in place at any other time, earlier or later. And these measures are still there in place. All right? And look at how our experience, and even how we have been able to handle this, the virus. We have done very well as a government. I'm not saying this because I'm in government. I'm saying this because I know what the government is doing.
And at that point, what are you rating how the government has performed on?
I would say the government has performed exceptionally well. Because we have every measure in place. We have the necessary facilities for quarantine, the necessary facilities for isolation. We have PPEs, the personal protective equipment. We may not perhaps have enough, because no country has enough as of now. But in terms of being able to respond, as at this very moment, we have enough to be able to respond. Maybe if, infections, get to become too many, then of course we may run out of them. But the government is also considering that. And because they're currently in short supply globally, we're looking at, being able to manufacture them here in the country. And therefore, any shortfall that may be realized later on and making perhaps difficult for such equipments to be purchased in the global market, we'll be able to purchase them locally.
Speaking of the infections, the Ministry of Health is projecting 10,000 cases, at least in their projections, by the end of April 1st. Those projections are based on?
Those projections are based on what has been observed happen in other jurisdictions, other countries. Are also based on modeling. Okay, is it scientific? I'm not a scientist. I would not want to say, but I'm just looking at it in terms of what we have seen happening in other countries, and therefore their experience informs partly what you're saying, but also partly what we are saying is also informed by scientific modeling. But we don't need to wait to get there. Okay, and how should we not get there? By practicing simple basics. They may sound very simple and easy, but they are very effective. Wash your hands.
Good. I'll let you continue, but I understand we have a caller from Meru. Good evening. Hello, TV47. Good evening, if you can hear me.
Yes, I can hear you. Yes, ni Eric. Napiga simu kutoka Meru. Yes, I can hear you. Eric, napiga simu kutoka Meru.
Yes, go ahead. What are your thoughts? You have any question you want to ask?
Yeah, I have a question.
Go ahead.
The government spokesman.
Mm-hmm.
Okay. How much does Kenya require at least to give each citizen at least 10,000 to go for a total lockdown?
How much does the government require for a total lockdown?
10,000 to go. Go for a total.
I think I got the gist of your question. Nonetheless, I can't hear you well, but I'm assuming he's asking what will be needed for a lockdown.
And you know, it's a question that's already been answered. That I cannot tell you that I will require to have reached maybe a figure of maybe 1,000 or whatever number. But I'm saying that there is a committee that's looking at all scenarios, and it is looking at based on how events are unfolding as far as our infections are concerned. And it's not one individual's irresponsibility. It's not the Minister for Health alone. It is a team that is looking at all possible scenarios and how such scenarios, should they happen, should be handled. And when that time comes, should it come at all, then a decision shall be made. Good.
Dr. Peterson, 10,000 projection number at the end of April, is that too much? Or are we fairly in our range, in a range that can be combated?
No, I think that is not too much, and I think it's based on scientifically we say that in an infectious disease, one person is probably can infect, we say 2.6, but because there is no half person, we say about 3 per day. And of course, it's like a pyramid, where one person, then in a day, that's 3 people, and the 3 people will have their 3 people, and then you count the days up to that duration, and that is how now modeling works, at trying to get the numbers within a certain duration. And what I must say, and what Kenyans must expect, is that it's very normal that the cases are going to go up. But what we are trying to say is that if we can be able to be disciplined enough to follow these laid down measures of social distancing, of maintaining hygiene, what we are doing, and that is what we are calling flattening the curve, so that the 3 people we are talking about that you can be able to infect in a day, so that you don't infect them, then the import of that is that you flatten the curve, because when we are talking about 10,000, we are talking about if these people were to transmit without the transmission being checked. But how can we check this transmission? It's by us Kenyans ensuring that there is social distancing, ensuring that there is hygiene, and if we'll be able to do this and cut the transmission, then the curve is not going to go up, meaning the number of infections will go down, and then our system will be able to manage the people that will be having, that will need to have medical care, because the real problem with COVID-19 is not that it's deadlier than the others. It's that it has an infection rate that can infect so many people within a very short duration. And what that does to the health system is that everybody will come to the hospital at the same time. They are going to exhaust the resources. They will not fit in the hospitals. And so even people who are not supposed to die from the disease will die because of that.
Now, let me ask you, you talk of flattening the curve, which has been used as a workable, doable way of combating this. The numbers as of now stand at least per the 22 extras that we saw today, stand at 81 cases. How do you flatten a case with a projection of 10,000 before the end of this month?
How you flatten really is by first understanding that this is something that we have to have a communal approach. That it's not a government affair, it's not a health workers affair, it's not Kenyans affair only, it's all of us together. And why am I saying this? It's because the government has its part. It can put the measures in place. But if people do not follow, If people do not understand why they are being told that they need to do social distancing, why they need to stay at home, then that is the only time that you will not be able to flatten the curve. The 10,000 is when we are not flattening the curve. But if we can be able to flatten the curve, and which, by the way, 85% of mitigation of COVID-19 is not government. Is not the health workers.
Individual hygiene,
it is Kenyans, it's individual responsibility for us to ensure that we don't transmit to the other person.
Good, I think point made. Cyrus, let me ask you this question. There are 4 counties that have recorded their first cases. This is inclusive of Kiambu, Muranga, Machakos, and Nyamira. How much of a concern is it to the government that these cases are getting to the counties, while initially the hotspots were 6 counties?
Let me put it this way. The 22 individuals who tested positive today, 21 of them are from outside. Meaning that even those counties that we're talking about, they're not necessarily people from those counties as of now, because all of them are tested from a quarantine facility. They're people who are out of the country and they moved into the country. So when we did mention, or as a government, that everybody who is coming into the country must enter into a compulsory quarantine. And we had several facilities that had been designated for quarantine. So when the government went into this,
did they get to interact with the people in those counties?
No, they have not gone out of the quarantine. Just they are, normal county.
They came to the country and they were placed under quarantine.
They have not been able to get out of the quarantine facilities, even as now. And it is out of that mass testing of those who are in quarantine facilities. It is when these 2021 plus 1 were able to were detected.
If they didn't get out of the quarantine facilities,
that tells you
why are they classified with the counties then? And
that's what I'm saying, that those are their former their countries where they originate from, but they are all from outside. This also demonstrates the importance and the significance of quarantine, because if we did not necessarily institute compulsory quarantine and allow these people to get into the estate to mingle with the community, then you can imagine where we would have been by now. And therefore I think it's important to appreciate the importance and the significance of quarantine, that the government instituted to ensure that everybody who is coming outside of the country must enter into any of these designated facilities. So they are not necessarily coming from those counties, as it were. Yes.
But this surely may have raised eyebrows and concerns within these counties, isn't it?
It's not. I think what we have said, and that's what the doctor said, and even including the minister and all of us, is that there is now community infection. So every community must be concerned about this, infection, because people are moving, and we don't know who has the disease as of now. It could be me, it could be you, it could be the doctor here. So in every county, every locale, every location, we must be able to practice and exercise the advisory that have been issued by the government.
Fair enough. Preacher Kid 254 on Twitter is asking, I think the government rather is giving a suggestion that he says, I think the government was misled by allowing the Skype interview between the COVID recovered patients, Brian and Brenda, to be aired to us, because this will give us that attitude of this thing is curable, thus ignoring the utilization of the regulations of the Ministry of Health. Do you want to respond to that? As to why the cases were made public?
The cases were made public to also demonstrate to our people that this is not necessarily something that cannot be treated, but nonetheless, it requires us also to continue to observe the social distancing and hygiene. And that is important because there have been situations during which other people had been looking at this disease as one that once you've gotten it, then you must be counting your days, which is not true, and therefore there was an aspect of stigmatization, and therefore bringing the Brenda and Brian,
yes,
and there it's a testament and testimony that this disease is not necessarily what people take it to be, but it's not necessarily reason enough for us now to ignore all measures to begin to abuse the various directives that the government has been able to put in place. We nonetheless must continue to to obey those measures. We must continue to exercise social distancing. We must continue to wash our hands and to quarantine in as much as possible.
Dr. Peterson, let me ask you this question. Given that there is no scientific cure as of now of a cure of this disease, what explains the recoveries that have been noted?
I think we must note that there are no cure for most of the viruses that we have. Mm-hmm. By the way, even the coryza and the common colds that we have, they do not have cure. Mm-hmm. They don't have a definitive cure. So it's your immunity that is able to fight for you. I think the trends that we have seen across the world and in the countries that have had these cases earlier mm-hmm. is that for young people, actually because of their immunity, most of them actually recover without even having to have maybe special medication. So that is something that we have been able to see. So it actually depends on the immunity of the person mm-hmm. at the time when they are getting this disease, COVID-19. Mm-hmm. And also, that is why we are saying that for those with a comorbid condition, that meaning that for somebody who is having another condition, mm-hmm. by the time they are getting infected, they are at a higher risk, and of course the elderly, because of their immunity. But if your immunity is okay, the same rule that applies when you're having a flu, it's the same rule that is going to apply mm-hmm. when you're having COVID-19, and that is your immunity. Because even for the drugs that you hear that we are giving, mm-hmm. the ones that are under tests, it's not that those drugs are going to help you, or are going to definitively mm-hmm. Wipe out the virus from your system. It's that those drugs work to relieve the symptoms, and of course, because most of the time what happens to your lungs is your immunity response, mm-hmm. and the response of your immunity will cause the hardening of the lungs, which we call fibrosis, mm-hmm. and that is actually what is killing people. So if we have seen that if you can be able to delay this immune response mm-hmm. so that it doesn't harden your lungs and you're not able to breathe well, then you can actually give time to your immunity to be able to fight this condition. So there is no definitive cure, uh-huh. but you can actually recover from this.
I think you have made a point for that. The strength or weakness of one's immunity has been an issue throughout to one's ability of possibly recovering from COVID-19 or otherwise. That as well has been a justification for many saying that this is a disease for the old and the elderly. Just for purpose of clarity, this affects across ages, isn't it?
It affects everyone, and I think we have a case in Kenya who lost a kin from, I don't know if it's the US, mm-hmm. a 38-year-old. We have seen cases of even 20-something-year-olds mm-hmm. Who have even gone up to the point of going into ICU. So it doesn't mean that if you are young, you cannot actually die. And we are also having so many people here who are living with some conditions that may bring their immunity down, like HIV. And so it's we cannot then be careless and say that it's a disease of the old. I think also, as the young people, and owing to the fact that we are not getting those very severe, into the severe condition, we must also be very responsible, because we actually can be the super carriers that transmit mm-hmm. to our old people. And I'm sure we all don't want to infect our parents and to see our parents die because of our carelessness.
I understand we need to take a short break, but before we do that, Mr. Oguna, let me ask you this question. For anyone probably watching this or will find out of this a little bit later, who still needs an explanation as to why they should take COVID-19 as serious as it should be taken, what will your answer be?
Everybody should take this disease seriously. Mm-hmm. And let me just, before I even proceed further, let me just say this. That you see, based on what has been seen happening elsewhere, we know that there's a 30-year-old journalist who died in Zimbabwe.
Yes.
There's a 23-year-old girl who died in the UK. You know, it is not right to say that that it's only a disease that kills old people. Mm-hmm. And therefore, every one of us must be able to take this advisory and measures seriously. We have seen cases whereby people are moving away from the urban center into the villages, so that they're running away from Nairobi and to go to the villages. Some young people, but you see, as you run away from Nairobi, and we know that most of our elderly, people, our grandparents are in the village, all right? And therefore, we are going there, running away from this, but without knowing that you perhaps maybe already be carrying this disease with us. And therefore, you're going to endanger their lives there. And therefore, we are saying at government, stay where you are. As, whether young or old, stay where you are. But therefore, it is important that young people, all of us generally, must be able to take this seriously, because it's not just affecting, our social fabric, but also it's affecting our economic, and factors of production. Right now, if you look at many businesses, they are at standstill. Many people are not making us, and even some livelihoods have been disrupted, others have been lost, and because of this. So it's not just about life, but also about, economic realities.
All right, and at this juncture, we are taking another short break here on Spotlight. We'll be back with this discussion after this break.
Gesturing. It is on the same point of affirming. But in this case, on gesturing, this is where, as a teacher, you are working.
The second reason why entrepreneurship is important is also that it helps you to plan for business finance. Business finance here simply means how much money do you need at the point of starting the business, and when is it needed, and is it for a short period of time or for a long period of time?
We still feel that the tourists are not getting value for their money. That experiential experience they are looking for is not there.
Welcome back to Spotlight. Thank you for choosing to stay with us. Tonight, the question we are asking you is how best you think Kenya can and the globe can combat COVID-19 or otherwise coronavirus. You can call us in studio on the number on your screen, text us on 22047, tweet us at Tv47 Spotlight, at Tv47KE. Top Secret, I see on Twitter, is asking, 500 million has been approved by the World Bank to help fight COVID-19 in Kenya. How is the government going to allocate these funds? Is the government going to allocate some funds to each county? Oguna, would you love to respond to that? Sure.
Yeah, we as a government must be able to prepare effectively well. And preparation here, has got so many elements into it. We have to equip our health facilities. We have been able to bring Bagathi from zero to what it is now, which is now a 120-bed isolation facility. We have got Kenyatta University, a hospital which has been brought, and equipment being bought. We are looking at other facilities across the county as well. All the counties. We are training medics. We are buying ventilators. We are buying PPEs. We are passing information. There's a lot that needs to be done, in order to be able to effectively prepare to deal with this pandemic. And therefore, the money that the World Bank is giving is not just money that will be dished out to individuals. It's money that is targeted to specific, areas that are aimed at enhancing our capability and our capacity to deal with this, pandemic.
And just for purposes of clarity, this money has been approved but is not yet within Treasury's hand, isn't it?
Yes.
Good. Dr. Peterson, let me ask you this question. Understanding that of the 518 ICU beds in the country, 87% are currently occupied. Even with the 314 beds in 53 private hospitals, 118 are currently occupied. Understanding and looking at these numbers, should there be a worry?
Of course, we must worry as Kenyans, and we must not only worry, we must move from the worry and of course take the measures that will ensure that we do not have many people requiring the ICU beds. I think there is, of course, the issue of our healthcare and maybe how over the years we have not been able to improve it as we should have. But I think that is a discussion that we can be able to have after that, because I think even prior to this we raised it as a union. But for now we have to deal with the reality that we have a shortage of ICU beds, and as Kenyans, if we get to a point where we have so many people requiring ICU, then I think your guess is as good as mine. And
just on the science of requiring ICU, this arises from the complications because of COVID-19?
Yes, when you have a severe disease and move to critical, as I was trying to explain, is that when this virus will attack you, your immunity will respond. And the response sometimes, if your immunity is not that good and it gets to the lungs, then it causes something that we call fibrosis. Fibrosis is hardening of the lungs. Your lungs are not supposed to be hardened because they are supposed to expand and take in air. When it reaches that, then you need support. You need to be given ventilation and oxygen, of course, and that is where now you require the ICU. So the numbers we have seen from the other countries is maybe 5% to 10%. And so when we are saying that we flatten the curve and we ensure the numbers are low, is so that the 5% of those who may require ICU can fit in the facilities that we have.
In fact, I have data from the US. For instance, between 21 to 31% of COVID-19 patients have required hospitalization, and 5 to 11% have required intensive care.
Yeah, actually that's accurate. And I think those are the figures that we have to work with, and that is where we do not want to reach as a country, because as medics, we know that if we reach at that point, then things will not be very good. So it's better we take the preventative measures that we can be able to take now, so that we don't reach there.
Good. But also in addition to that, brother, is that even among the plans that the government has is to be able to expand our ICU capacity, from what it is around 500 and something to about, 1.5 or 2.5 times double that. And when MOH projected that we are likely to have 1,000.
1,000, yes.
And yes, according to their projection, that even if we get to 10,000, not everybody will end up being admitted in a hospital facility. But should it get there, we are looking at expanding other institutions into isolation centers, converting educational institutes, like schools that were boarding schools, so that they can be able to take up, patients or cases that may require to be, brought in. But should it become even much more than that, then we are also looking at the possibility of converting even stadiums like Kasarani.
And close to half of the counties have no ICU beds. Nonetheless, Fisi Njugamai on Twitter is asking, my question to the government spokesperson is, do we have enough testing kits? I'm worried because the other day nurses wanted to stage a go-slow due to lack of equipments.
We have enough testing kits. You remember a couple of days ago, we were able to receive about 25,000 testing kits from Jakma. We've also been able to receive another, 2,000 that we bought ourselves, another 2,000 from well-wishers. So we got something in the range of about 30,000 testing kits. So we, as of now, we are in a good place. But of course, that is not enough if we get into serious community infection. And therefore, the government has plans to be able to consistently keep on adding on, this case, testing kits, so that we don't run short of them.
I understand we are out of time. Let me ask one final question. Dr. Peterson, someone is asking how safe are our clinical officers with one clinical officer having already tested positive?
Yeah, actually there is that colleague of mine from Nairobi County who got now from the community spread while in line of duty. And she's currently in isolation. And we must also admit that there is a challenge. There is really a shortfall in, especially when it comes to training. And when it comes, there is a serious shortage of protective equipment. And I want to applaud the government if then they are going to produce them locally. But I want to urge them to expedite this process because the disease is already here with us. And being the frontline health workers, because we are the first people to see whoever comes into the facility, then it's very important that health workers and especially clinic officers who are the front line feel that they are protected so that they do not have anxiety and panic. Because sometimes when that happens, like in West Africa, we saw that health workers actually ran away from the facilities. So the issue of training, especially because 90% of our members have not actually been trained on the aspect, on the simple aspect of the protective measures.
All right, I understand we're extremely out of time. Training and protection, you say. Let me give you your last thoughts as well, government spokesperson.
I think mine is actually to ask our people to be able to obey government instruction, government advisories, because that is the only way. These instructions sound very simple and very basic, but they're very effective. Finally, this is not something the government can do on its own. It must incorporate the people themselves. And therefore, aspect of discipline, aspect of being complacent, a thing that they should be able to work into, so that whatever the government says, it is actually aimed to protect the lives of Kenyans. So therefore they should pay attention to those a directive and instruction, and they should obey them.
Thank you, government spokesperson Cyrus Oguna and Dr. Peterson Wachira, the national chairman of the Kenya Union of Clinical Officers, for making time for us tonight.
Thank you.
Well, that brings us to the end of tonight's edition of Spotlight. I'm Abubakar Abdullahi. On behalf of the entire team that made this production possible, bye for now. Wash your hands, stay safe, stay at home, and of course, keep a social distance. Good evening.
Look at gesturing. It is on the same point of affirming. But in this case, on gesturing, this is where as a teacher, you are working.
The second reason why entrepreneurship is important is also that it helps you to plan for business finance. Business finance here simply means how much money do you need at the point of